On Capitol Hill, celebrities, activists, and doctors came together to address the Black maternal health crisis.
Now, despite spending more money per capita on maternal health than any other country in the world, the U.S. still ranks a dismal 55th for women dying during or after childbirth, and the odds are dramatically worse for women of color.
Yesterday, the House Oversight Committee heard emotional testimony calling for action to reduce Black maternal deaths.
We must increase the pathways for birth workers of color. There are not enough Black workers of color, leaving Black birthing people with limited autonomy or opportunity to receive racially concordant care, which is associated with improved maternal health outcomes for Black mamas and babies.
The birth of my oldest was my first experience of a kind of institutionalized racism and paternalism that can kill.
It was lack of compassion and lack of humanity that failed my wife and is failing Black mothers time and time again.
Structural racism puts Black people giving birth in danger. And regardless of personal strength, educational attainment, or even fame or fortune, as Mr. Johnson so eloquently asserted, this is a matter of human rights.
Joining us now are three people who testified at yesterday's hearing: National Birth Equity Collaborative founder and president Dr. Joya Creer-Perry, actress and advocate Tatiana Ali, and For Kira for Moms founder Charles Johnson. Thank you all for joining us this morning. We really do appreciate it. Dr. Creer-Perry, I want to start with you and with the statistics. The CDC says that Black women are approximately 3 times more likely to die from pregnancy-related causes than white women. Why is that? What are the factors that are at play here?
Well, we know that Black is a social and political construct. There's no genetic basis of race. So when you see outcomes that are worse for Black people, including maternal health outcomes, you have to look at the social and political causes like racism, classism, and gender oppression. So we know that there are places where Black women show up, like Serena Williams so eloquently talked about. No matter your income, or like my colleagues who are on this call, no matter your income, your education, Black birthing people are 5 times more likely who have an advanced degree to die within a year of childbirth than their white counterparts. So this is not about individual behaviors or choices. This is about racism, institutional, structural racism.
Tatiana and Charles, I know that this is clearly deeply personal for both of you. Tatiana, I'll start with you and just ask what legislation that you're hoping to see here. What do you hope happens next? And how can, especially with what we just heard there from the doctor, how can legislation help?
Yesterday was my first experience doing a hearing, and I got a lot of hope. I hope that they pass the Momnibus bill. It's sweeping and it's far-reaching. It would make a big difference. Also, you know, my emergency C-section that I talked about cost $140,000. Working with my midwife cost $8,000, and I found I had a very difficult time getting reimbursed from my insurance company. The hospital got reimbursed immediately. Access to the kind of care that we choose, that we want, would make a huge difference. I'd like to see that. And I was a bit disheartened, though, and it was a minority, but the minority on the other side, I was disheartened by feeling that we had to explain again and again that racism is real. And it's very similar to having to explain again and again that as a birthing person that you're in pain and not being listened to or believed. You know, you have a groups actually of people who are crying out again and again, we are in pain. There is a problem. Racism is real. Believe us. Believe us.
Charles, you gave heartbreaking testimony about how your wife, Kira, died after giving birth to your second child. What was the fundamental reason that you believe you ended up faced with this tragedy?
It's quite simple. In my wife's case, she was not only in good health, she was in great health. We did everything right. We were extremely diligent all the way down to every single prenatal vitamin. We went to what we thought was supposed to be a top-notch hospital, but it was because of the color of my wife's skin that when we expressed pain, as Tatiana mentioned, when I cried out for help, they allowed her to suffer and bleed internally for more than 10 hours while they did nothing. So I I'm clear about the fact, as we sit here today approaching another Mother's Day without my wife, that she would be here with her boys if she was a Caucasian mother.
And Dr. Creer-Perry, most of these deaths are preventable. I mean, we just heard what Charles believes happened with his wife. What are the most immediate things that need to change?
Well, we know that at least 60% of the deaths, according to the CDC, are preventable. And there are things like ensuring that people can go to the providers that they wish. I mean, think about Tatiana's story. She really wanted to have a natural birth. She wanted to be able to labor and not to have a C-section. And so having her voice listened to and heard, so having more access to midwives and doulas and birth centers, and also having the physicians like me, my fellow colleagues in OBGYN, really work on our bias, work on undoing the structural harm that we've learned. We have to unlearn so much harm that we were taught inside of healthcare. So that's what we're doing right now, working with our colleagues to do that.
Tatiana, as an advocate, you had your experience, and then I know you spoke to a lot of other Black families who had similar stories. During the hearing, you talked about the importance of needing to demedicalize birth. Now, a lot of people might hear that and not quite understand it. What exactly does that mean? What is it you're pushing for here?
That means I'm, in no way an expert or a doctor, but for me that means births that are not complicated, not having unnecessary interventions, not pushing Pitocin necessarily, not pushing epidurals necessarily, if that's not the wish of the patient. There's birth is something that is natural. It's not an illness. That is really not treating birth as an illness. And there are other modalities out there that throughout the world have better outcomes. Now, here's the thing: we should have access to it all. I think the best science, the best medicine, the best holistic care. We should have access to it all. This is America. We know what they know what works. That's the thing. When complications arise, then yes, the hospital, have everything. That's what I mean by demedicalized, because for me, I think that epidural really put me in a position where, I couldn't move. I wasn't allowed to move after that epidural, actually. I was pinned down. I wasn't allowed to move.
Charles, I can only imagine that Mother's Day is a difficult holiday for you. What will you do to celebrate Kira? The photos and videos that I've seen of her, I mean, she's just beautiful, so vibrant. What's it like to celebrate her over this weekend? And how do you talk to your boys about their mother?
Well, I think what we really do is we really just do our best to celebrate Kira every day. Kira is very much present in every single thing that we do in our house. There's huge pictures. We tell stories about mommy, but even with all that, it's still very painful. My sons will ask questions about, why can't mommy come home? I want mommy to come home. And so it's difficult. And some things, as a father, you simply just don't have answers to that are adequate. And you just don't have a solution to fix that void. And that's why we're fighting so hard, because even though there's nothing that I can do to bring Kira back and the other mothers that we lost, it's so important that we do everything we can. And we rally our legislators, our advocates, and all these stakeholders to do everything we can to make sure we send other mothers home with their precious babies.
And Charles, I think that you're advocating for that and telling parents to push for what they need when they're in these situations, and the hospital will save lives. So thank you for what you're doing. And Dr. Creer-Perry, Tatiana as well, thank you for joining us and sharing your perspectives, being vulnerable with us. Thank you all so much.
For the families out there listening, you don't. There are other ways. Look to organizations out there to get the resources that you need. You don't have to be scared, but you have to be diligent. Black Moms Matter organization, for example, is a great start.
Thank you. Thank you for that important information there.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.